Goeienaand, good evening, fellow South Africans and citizens of the world. And wow, this coronavirus has certainly got South Africa by the balls, hasn't it? You know, your Minister of Health, Zweli Mkhize, he's off to a flyer. My gosh. And of course, the number of COVID cases in South Africa has risen now to 554. I am, just for the record, I'm trying to organize a live stream in the next couple of days with a couple of people relevant to this lockdown. I'll give you further information or send out a preview icon so you can be alerted to when it goes live once I have confirmation from the parties involved. It's going to be a very serious discussion looking at the options for the minority community. Just be aware of that in the background. Okay, let's get the info. The number of COVID cases has risen to 554, Health Minister Zweli Mkhize said on Tuesday. Mkhize announced the department had recorded 152 new COVID-19 cases. He said anyone who refused to be isolated when they tested positive for COVID-19 would have their names published to warn the public to not get close to that person. Mkhize said, if we ask you to go to quarantine. If you don't go to quarantine, we will enforce it. He said a person could face up to 15 years imprisonment if they were in breach of the regulations around testing positive for COVID-19. Mkhize also warned that the 21-day lockdown announced by President Cyril Ramaphosa did not mean the country was safe from the spread of COVID-19. The move, he said, was aimed at managing the spread of the virus, especially internal transmission, or the clusters. He used the transport sector, including trains and buses, which transport around 16 million people, South Africans, daily, as one of the reasons why government has tried to control the spread of the virus. That's what I've been talking about since it hit South Africa, is the bus being the perfect incubator, like a petri dish, for this virus to spread amongst the African population. Took a long time for them to actually wake up to it, didn't it? The horses bolted. Anyway, Mkhize said the number of positive cases were expected to go up for at least the first week of the lockdown. Well, I think that they've got this all wrong, personally, but time will tell. This is my perspective of what's going to happen in South Africa. Most of the people who've tested positive for COVID-19 are those who, by volunteering, have gone forward for a test, or they've gone to a doctor and in some cases paid up to 1,400 rand to have the test. Absolutely incredible. And there are, I would suggest, a large number of people right now in townships all over the country who are sick with the coronavirus, but they're not reporting to a hospital. They're just trying to stick it out at home. And if that's the case, they're infecting dozens more people, and this thing is going to explode throughout the community. And I would suggest that what I've just said is probably what is going on right now in South Africa. But regardless, Mkhize said, the lockdown helps us to reduce large numbers of people moving where infection flow without actually being unmanageable. However, it does not mean lockdown on its own solves the problem. He said the country still needs precautions in place because in the experience of China, where the virus originated, 75% of the spread happened in family settings. Now, that's exactly my point. In some of these shacks in these townships, you've got up to 10 families living cheek by jowl together. One person in that shack gets the virus. It's a no-brainer. It's going to spread through those people in that shack, and they're going to be interacting with other people, and you get the idea. It's a cascading situation. The hygiene of blocking your nose and mouth when you cough, watching your distance between someone who is coughing or sneezing is still very, very important. The issue of washing hands and hygiene is still very, very important, Mkhize said. He went on to say, people mustn't think the president has declared a lockdown. We are now safe. No, this creates an environment, a condition under which we can all fight against the spread of the infection. All South Africans had a role in combating the spread of the virus, he said, and warned that the country may still lose the battle against the spread of the virus. No deaths have been recorded in South Africa yet, although there are 2 patients in ICU at private hospitals. Now, my information that I've received, and again, this is unsubstantiated, not that it makes any iota of difference anyway, but my information is that there is 1 person who has died, but they're not talking about it. And this has come from a credible source, but I'm just going to say it's unsubstantiated. I don't trust this ANC government as far as you could throw the biggest member of the parliamentary team. Anyway, that's my take on it. Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.